If you had preeclampsia and felt like nobody really explained what it meant for your body long term, please listen up. As a clinical epidemiologist, I see this as one of the most undercommunicated pieces of research in obstetrics. If you've been through preeclampsia, you know how intense it is during pregnancy. But a lot of women say that once they delivered, their care team moved on. Baby is healthy, mum's blood pressure is coming down, and that's often where the conversation ends. What nobody told you is what the research has been showing us for years, and the new 2026 data has just extended this further. Here's what the evidence shows. Women who experience preeclampsia have a 72% increased risk of cardiovascular disease later in life. That includes heart attack risk as early as 10 years after your first pregnancy. New research published this year extended this to peripheral vascular disease, conditions affecting blood flow to the limbs. What this means is that pregnancy is increasingly recognized in research as a cardiovascular stress test. If your results were abnormal, if you had preeclampsia, gestational hypertension, or gestational diabetes, those are not just obstetric events. They could be early warning signals for future cardiovascular risk that your long-term health management should account for. This is something I wanted to touch on because most women are discharged without this information. So if you had preeclampsia, there are two things worth doing. First, ask your GP at your next appointment for a cardiovascular risk check. Blood pressure, cholesterol, blood glucose, especially if it's been 12 months since delivery. Second, let your future care team know. This should be part of your ongoing medical record for any follow-up care. This is part of my postpartum recovery series. Head to my page to see the full series. And I cover new research like this every week for women navigating pregnancy and postpartum.